I'm going to talk to you about feeding your baby today. Breastfeeding is a learned skill which will come easy to some and need a little guidance for others. You probably decided long before your baby was born exactly how you would like to feed your baby. Our midwives are here to help you whether you have decided to breast or bottle feed your baby. If you have decided to bottle feed, your midwives will support you to safely make, store and use formula. You do not need to bring anything into hospital, but you will need to be prepared at home. The World Health Organization recommends breastfeeding exclusively for 6 months with continued breastfeeding and other foods until 2 years or beyond because of the many benefits for families. Some benefits include protection from viruses as the mother passes antibodies from her milk to her baby and the establishment of healthy gut bacteria that supports baby's immune system. Babies who have breastfed have lower incidence of ear, gastrointestinal, respiratory, kidney, urinary tract infections and diabetes. Breastfeeding helps brain development, eyesight and speech, mouth and jaw development. Mothers who breastfeed decrease their risk of ovarian, uterine and breast cancer and reduce their risk of diabetes and osteoporosis. And of course, let's not forget that breastfeeding helps protect from SIDS. Following your baby's birth, we encourage you to be skin to skin as soon as possible with your baby, uninterrupted until the baby is able to find its way to the breast and have its first feed. Over the course of the first 24 hours, baby may only feed 3 or 4 times. He or she will get colostrum, a thick, yellow, rich first fluid that is full of antibodies and nutrients. Your baby will probably only pass urine once and have a black meconium poo. On day 2 and 3, your baby will still be receiving colostrum. They will most probably feed very frequently to encourage your milk to come in, and this can be very tiring, so ensure partner and family support is there to help you, and getting sleep whenever you can is vital. It's important to follow your baby's feeding cues at this time as it helps to build supply and reduces your risk of engorgement when your milk comes in. Your baby will probably pass urine 3 times and the colour of your baby's poo will change to a greeny brown. By day 4 to 5, you may notice that your breasts are getting heavier and you'll be hearing louder swallowing and gulping as your milk supply increases. By day 5, your baby should be having at least 6 to 8 wet nappies a day and having yellow mustard coloured poo. We know that the first few weeks can be difficult and new mothers worry about milk supply, sore nipples and mastitis, but we're here to support you and help you, and you'll find lots of resources on our website. As you and your baby become more experienced, we are confident that you will both find breastfeeding enjoyable, convenient and a really special time to grow and bond together. As your baby grows, your body will make the amount of milk your baby needs. That may mean that during growth spurts, your baby will feed more often to increase your supply. This doesn't mean you are losing milk though. Support from partners and family is vital in ensuring the success and enjoyment of breastfeeding. Research shows that mothers who have supportive partners are more likely to breastfeed their babies. This may mean tag teaming, with partner changing the baby when it wakes and taking it to the mother for the feed, at which time the partner catches a nap. Then the partner can come take the baby and settle the baby after the feed so mother can go back to sleep quite quickly. No one gets a lot of sleep in the first few months of a new baby's life. This is really normal and it will pass as baby gets older. Breastfeeding can be a little tricky to begin with, but with the support from your midwives, breastfeeding support service and groups like the Australian Breastfeeding Association, you and your baby can quickly overcome any early problems and hopefully enjoy the many benefits that breastfeeding offers.